Epidemiological situation of COVID-19 in the Sultanate till the end of July 2020. More than 18 million COVID-19 cases and about 700,000 deaths have been registered worldwide. Continents of America and Europe are on the top list of the infected cases and deaths. The Emergency Committee on COVID-19 has announced in its fourth meeting on 31st of July 2020 that the outbreak still constitutes a public health emergency of international concern and stressed the anticipated lengthy duration of this COVID-19 pandemic. The committee has also confirmed the importance of sustained national and global response efforts. The first COVID-19 cases that have been registered in the Sultanate are for two Omani female citizens coming from Iran. Registering other cases across the Sultanate has continued, with the confirmed cases reached 8,286, with a 77.6% recovery rate till August 5th. The total number of tests has reached 308,333 tests since the beginning of the pandemic. The case definition has gone through several phases based on the epidemiological situation. At first, the case definition was related to traveling to endemic countries, but after the spread of the pandemic in the community, the definition was changed to be more effective to recognize the infected cases in the Sultanate and the demographic distribution and spread of the pandemic. Information and epidemiological and clinical characteristics related to the pandemic have been studied and analyzed. It also has been identified the risk and spread factors in the Sultanate during the past 6 months, which showed the admission rates were accurate indicators to monitor the disease. The last update of COVID-19 definition in the Sultanate was issued on July 25, 2020 to keep pace with the global and local epidemiological situation, in which all severe pneumonia cases will be subject to lab tests except the mild cases. Maintaining the precautionary measures and infection control is necessary for the suspected and confirmed cases and contacts with the clinical follow-up for all cases. All the lab tests are available in the Central Public Health Laboratories as well as in all referral hospitals. The Minister of Health is working on introducing referral public health laboratories in North Al-Batina at Dakhiliya governorates in order to enhance the diagnosis capacities for the public health emergency. To monitor the epidemiological situation of COVID-19 pandemic in the Sultanate, the following indicators will be adopted for the event of emerging another wave of the pandemic in the upcoming phases. The number of cases admitted in the hospitals in general and in the ICUs in particular. Sentinel sites across the Sultanate, using the results of the National Serological Survey of COVID-19, using the number of daily deaths per million inhabitants and comparing to mortality rates in recent years. The latest epidemiological data refers to signs of decreasing in the total number of infected cases and the cases admitted in the hospitals and ICUs.